So I went to the emergency room with a ruptured eardrum, and I was literally sitting there crying in pain for 3.5 hours before I was seen, and there was no ambulance driving up or anything like that. There was no reason for there to be a distraction, I guess, or not one that I saw. And not only did I have to wait 3.5 hours, I had to pay a $4,500 bill for a doctor to walk in the room, look in my ear, tell me I had a ruptured eardrum, give me pain medications, and send me on my way. So the cost really offended me with how little I saw a doctor and what little attention I got.
Like any married couple, you look at your medical options, and of course it was better to be on my wife's option, and of course less expensive. Then the following year, the restriction came in, well, if your spouse works for a company that offers medical coverage, you either literally get hit with a fine if he continues to stay on there and not take their company's insurance, which didn't make sense. You know, you check to see which is more advantageous for you and your family as far as affordability and access to medical care. And based on what we looked at, it was better for me to stay on her plan. But the following year, I was forced, you know. Well, let me take that back. I wasn't forced, but if I'd stayed on my spouse's plan, we would have been fined. Well, not necessarily fined, but that would have been part of your medical bill. You have health insurance taken out, and of course that extra $100, $150 per check taken out because I'm still on insurance.
I wasn't covered. My job didn't cover it. My income was low, but I just went to the hospital, and they have like services where you can just sign up, and it's like you pay a percentage, you pay a copay, and basically I was taken care of, and it's like free.
A few years back, my mother was really ill, and you know, of course they accepted her and they took care of her the best they could, but you know, they were always coming to the rest of the family and to figure out how the bills were going to get paid, because she wasn't covered at the time. So their main focus, to me, it just seemed like they were really worried about getting paid. And other than, I mean, they took care of her. She did end up passing away there, but it was just the financial part was, you know, how is this going to be taken care of? How is that going to be taken care of? When I think the focus should have been on getting her better and then worry about the money.
I basically don't have health insurance because I work for myself, so I pay for it, and I would say that's a problem because my what I pay is $688 a month to have health insurance. And I feel a problem in our healthcare system is that the health insurance is tied to one's employment. And I feel like that is wrong. In Europe, that's not the case. In other words, if you get a good job, you get health insurance.